I dip in and out of the whole politics of gamification, what's hot, what's not. For me, the key principle in the things that I do for Havas Lynx is getting the idea right. Understanding what the motivator is, understanding how we can use the idea the best. And what I've pulled out here is a bit of a personal thing, really, because this is the first game I sort of developed within healthcare, and it kind of made me think quite a lot about how people interact and things like that. And then also, I'm going to show you an example about adherence and how it can really play a part in a really strong adherence message. So, as I was doing a bit of research early this morning, this came up. As gamification transforms business, it also transforms our lives for the better. Now, the cynical out there will always say, Big Pharma, it's trying to shift units at the end of the day. We're trying to make sales. However, if I take that hat off, and my boss is over there and he will tell me often that these things cost money, I tend not to worry about that. I will just develop it for the best way I can. That means long hours sometimes that don't get paid, but that doesn't bother me at all. Because at the end of the day, I know that there's some patient out there, or there's somebody going to be using it, that it may potentially change, and it may help them get over whatever condition they've got. It may help engage them with, thinking about their condition in a different way. It sounds a bit arty-farty, but that's the way I approach these things. And the first example that I'm going to show you is a project that we called High-Rise. Now, High-Rise we set up 2 years ago. A global company approached us. They have a pen that gives you a growth hormone, and it has a microchip in there that is directly linked to adherence. So what happens is, every time the injection is given, it logs on their pen that they've given the injection and everything's that they're adherent to their medication. Part of this digital platform was to have an award scheme, basically. So you get stars, you unlock stars, and those are unlocked by your HCP. So the HCP will unlock the stars when you go online, and then you can trade them in for various things. So we were approached to make the engagement part of this whole process. Best brief ever. So we don't necessarily need to do the medical stuff. We need to know that there's medical involved, obviously, with everything we do, but we had to create a space that was fun, that was engaging for those patients, and basically where they could just enjoy themselves. So that was how High-Rise came about. So, we were challenged with this idea of kids having a space where they could not learn about their condition, but they could appreciate the fact that they had a condition that they were being treated for. And the thing that drove the idea behind this was, for me, I read some blogs before we approached this, and to try and get an understanding about what's going on. So there was comments like, he was crying at first, he's 8 years old, he was being given this injection, it was really scary for him, there was There was instances of bullying because they were shorter than other people. And that made me really think, do you know what? What's going to inspire these kids? What's going to make them feel that little bit better? So what we try to do is we try to create an online community whereby you can build a high-rise building. You can customise it, you can create each level, and each time you go on, you can unlock things. You get rewarded with points. You get rewarded with the ability to unlock a bigger building, unlock more items for your building, and then everybody around you is on that same treatment. So they all start to build their buildings, and it's a motivator. Within there as well, we had games like an arcade where you could unlock more in-game currency, and it was just a nice place to be. So we're rewarding for adherence, the community spirit with the city growing around you, your repeat visits on there and everything. So it's a game. You know, let's not be around the bush with this one. This is a proper game. Which is one of the things that I really try and do with some of the stuff that we do with kids. And that is, you want to learn or you want to educate about some of the stuff that we talk about, so some of the conditions, but we want to do it in a way that, you know, we've already talked previously about how fun and engaging games are. We don't want it to be the key principle. We don't want it to be the key driver. I don't want to go and play a game that's all about my condition necessarily. I want it to motivate and I want it to empower me somehow. So one of the key aspects that I really, really try and do with some of the stuff when we're talking about these games for kids, we've done games for kids about teaching about eczema. We've done games for kids that explore conditions in a fun and engaging way. But the main key thing is a strong story. Now, in all honesty, I'm a little bit of a Luddite. I don't use Twitter, and I know that's probably like anathema. It's probably quite bad. I keep getting told about it. I did join Pinterest though, because I'm getting married and I'm buying a house and all that stuff. So Pinterest is amazing, love that. But in terms of being that Luddite, technology shouldn't necessarily be the opener for some of this stuff. I think there has to be a crucial story, there has to be a crucial need. I last year got a brief from a client, quite a big global client. They approached us to do some gamification. We want Angry Birds, we want Mario, we want Sonic. And this was to teach basically people, clinicians, about how the MOA works within a treatment. What kind of a brief is that? It's still a buzzword. And I think to some of the points that we've raised earlier, you know, we need to get over that a little bit. I've been doing this now, not the gamification stuff, but interaction and design and stuff like that for about 12 years, 13 years. So I've seen the progression, and that's why, I mean, I did once say, and I'll hold my hand up, iPads, they'll never take on, right? Anyway. Yeah, so the absolute crucial thing, that whatever you're doing, it has to have a focus, it has to have a story, and it has to have that at the heart of it. Whether it's delivered on a phone, whether it's delivered on a website like this was, whether it's an app, whatever, it's got to really align to what we're trying to say at the heart of it. Okay. So some of the principles that I talked about there led us on to some of the elements that I'm going to show you now in this next example. This is a very early pilot at the moment. I can't show you too much of the details. It's kind of in a development phase. But this is a partner program for post-prescription. So it's for schizophrenia. It's for a schizophrenia treatment. And what we've done here is we've applied some of those typical game mechanics. So the reward, the progression, which is a fairly standard approach that we take now. So long as we can align it to what we're trying to do, then it's fine. But what we've also tried to do with this is look at the psychology around it, and I think that's the key factor for this. So it's basically a website and a scheme that's run in conjunction with the HCP. The HCP puts the patient onto it, and then they monitor and maintain the connection throughout the life cycle of the treatment. Okay. What potentially we can do with this down the line is another bit of a buzzword now, but it kind of excites me a little bit because I've watched loads of films and stuff about it. But the whole big data thing, that's a good talk right there. Big data, we love that one. The interest, I watched the program. I think it was Horizon or something like that, where MIT have done a really good study on depression, and looking at the things that drive depression. So for instance, when you're on your phone, you know, how does that change over time if the depression kicks in and things like that. So we get a baseline data, we start to see the changes, and then we can react on it. Well, with things like this, we do open up opportunities, and that's where we're trying to position a lot of the material that we're doing now in digital, is this wider ranging proposition and how we can connect up all the dots. With this, we have that opportunity. So we're looking at to pilot in March and April at the moment, but we are still trying to get people signed up to the pilot scheme. Okay, so with On Track, what we're asking the HCP and the patient to do is basically use the social media kind of elements that we're all used to, define goals, simple goals though. This is the main thing. This is schizophrenia. We're trying to get them to define the goals, so link up with friends, maybe play football. So we will enter all of the different interests that the patient will have, and everything that's delivered here is based on mood and interest as well. So we've got polls on there, we've got feelings, we've got patient stories, so we've got your basic kind of gamification approach to this condition. Okay. But then we introduced this other idea, which I think was really neat actually. It's probably because it was my idea. But I am a big Reddit fan. Does anybody Reddit? Yeah? Okay. So Reddit has this thing, and it's called Cake Day. Are you aware of Cake Day? So rather than have a birthday on there, what we'll do is the first time that we start and sign up to Reddit is when we have a cake day. So 12 months down the line, it's our cake day. It's a big thing. They all talk about it. They love it. So I thought about this idea of, well, this long-acting injection that we're giving to our patients, can we not change the perception that that long-acting injection is a negative? Can we not say that that is their road to well-being? So can we not make it an occasion? So what we did, we linked up all of the social aspects, we linked up all of the dates, all of the things that our patients are going to be interested in over here, and suggested, well, if you're having your appointment on that day, why don't you see us around? See which one of your friends, who's been predetermined in the list previously, it's not just open to anyone, see whether they're around. Do they want to go for a coffee? You know, are you feeling a bit blue today? Well, maybe you just want to watch a film. So we wanted to make an occasion, and we wanted to bring in geotagging, things like that from all of the other platforms that we look at, and make a big thing of positive and getting better. Okay. So then another idea that came about, sometimes when you are working on these projects, it will get to a point and something will happen in that project timeline that just sparks another idea. With this one, I watched a BBC News thing, and there was a big thing last year, I think, about how mental health in this country is just horrendous. You know, there was an interview on there with a lovely woman, and she'd said something like, you know, all I wanted was just some help. And I went and I was sat around for 3 days. I didn't get any help. I didn't get any assistance. I went home. I was hearing voices for 3 weeks, and all I wanted was that speaking therapy. All I wanted was that talking therapy, and I couldn't get it. And then I looked at what we designed, and at that point it was like, yeah, well, you get points for this, and you get all of this and stuff like that. But then I thought, well, what about if we could make that experience positive? If I'm going to link to a digital channel and I'm hearing voices and I want to kill myself, I need that response website. I need it to feel like something. I need to get something from it. So I came up with this idea of, we were already doing the mood tracking anyway. That was part of it. But I thought about, what about linking all of that mood tracking to everything that we're doing? So if I say on there, you know, I'm not feeling too well today, the colour of the website changes. So already I'm starting to get the psychology, which was mentioned before, starting to make it a better experience. I'm starting to reward the fact that, you know, all I want to do today is watch a DVD. Well done you. You're not thinking about your condition. You're not having those suicidal thoughts. You're thinking positively. It's this micromanagement of the positivity. And this then leads on to everything. So we define our mood, the mood changes on the website. The things that it's showing me to do with my friends is based on that level of mood. I don't want to tell a patient to go skiing if they're feeling down. It is literally a list of their favourite films. Why don't you go and watch that? That cheered you up on such and such a date. So it's all linked into the condition. And this is an example of the mobile version that we've done as well, so we can connect up to it wherever we are. Mobile is obviously, you know, a big thing. The thing is with mobile, the difficulty that we always have with it is getting the drivers to download the app. Mobile, again, is another one of those little bit buzzwords that we're always talking about, but to make it work, you really have to connect into the lifestyle of people. You've got to understand that, you know, I'm not just going to download an app, pick my phone out of my pocket and look at my condition. It just ain't going to work. I don't want to be reminded all the time when I pull my phone out of my pocket that I'm ill. So we started to take cues from Facebook and things like that, so like where we've got notifications about the diary, the goals, that kind of thing, and we're taking the cues from the stuff that everybody uses on a day-to-day. Just a simple approach. Again, we can check with our diary, all linked up to the GPS tracking and everything like that, so it's all linked into our getting better and our positivity. Now, the next example I may just skirt over a little bit because Alex wonderfully summed it up anyway, and it was the remission. Now, the one thing I will show though, because of what I've said previously about, you know, understanding that the person that's going to be using it at the end of the day is a person, not just a number. I love this quote. I think that's great. You know, I've been gaming since I was 7 years old. The immersiveness, the you know, I was saying before, it's a little bit of only child syndrome, I think, because I used to escape into games, and I love that. And I love the idea that if I am really ill and I'm spending loads of time being told I'm really ill, I'd love that bit of escapism. I'd love to be able to, you know, understand the world a bit better. So that's why I chose remission actually as a bit of a final example. I don't want to go too much into it because you basically covered this, Alex. So what I will do is I will go on to this bit.